All right. What's up, guys? What's up, guys? Andy here at Tricolor Fitness. Today, we're going to do a special video discussing pain. Okay, we're going to talk about pain. I'm going to talk about it from a gym owner standpoint, things I see with just clientele, everyday folks. And my man Chancey here is going to talk about it from a clinical standpoint. Chancey works at Novant. He's a PTA. I'm going to let him tell you a little bit about himself and what he does and why we can listen to him and get some of his advice. So take it away, Chancey.
Yeah, like Andy said, I work for Novant Health. I've been there 17 years. Kind of worked in all areas from in the hospital to inpatient rehab to outpatient. Most recently, I'm in kind of sports medicine, but I'm also back in the hospital some with all the COVID mess going on. I've kind of been privileged throughout my career to see people from first day after surgery or day of surgery to all the way out to chronic issues 20, 30, 40 years in the making. So nearly, I got a wide array of experience when it comes to pain and working with folks with pain and trying to figure out what truly is causing it. Is there an issue that's causing it? How much of it is subjective and their past goes into it and things like that?
Absolutely. Absolutely. We're going to make this, I want to make this where everyone can kind of understand it and relate back to it. So I have a few scenarios that I'm going to go through, things that I see kind of on a semi-regular basis with folks, maybe even with myself, okay, to help you not have that fear of pain, thinking that you're always damaging yourself. Okay, so I got a few things written down, so I'm going to read off here. So the first, I'm just going to pose this to Chancey, and he can kind of come back with what his thoughts would be on it. Okay, so here's a very typical one. Okay, let's say I've been sitting at a desk for 10 years. Like a lot of folks, they are desk workers. The back hurts from time to time. So they already think, oh, I must have a bad back. My back aches, okay? And then they start an exercise program, right? Start an exercise program, 3 or 4 weeks in, your back is really bugging you. So now you're starting to think, oh my gosh, I'm hurting myself. What should I do? Should I stop exercising? Should I go to the doctor? Should I get an x-ray, an MRI? What should I do?
The biggest thing is understanding how human biology works. I went back and got my master's degree in human movement and exercise science. And one of the big things that my research was on is how long it takes biology to change. And a bare minimum, it takes 6 to 8 weeks for the tissue and the body to actually start to change. So someone who's been sitting at a desk for a long time, they've got 10 years of being adapted in that position and kind of being used to that. Then all of a sudden they start a new program, and we see this a lot in the clinic as well, is they'll come in, they've been hurting for a long time, and we'll start them on strengthening, stretching, mobility, all that kind of stuff, working on their deficits. And about 2, 3 weeks in, the body starts to begin that change. And then they're like, uh-oh, there's some new pain is creeping in, some new feelings are creeping in, because people can do the exact same movement and have the exact same diagnosis, exact same test at everything. And one person has 2 out of 10 pain and the very next person has 10 out of 10 pain. And there's no correlating factor for why. But the problem is they don't stick with the plan long enough. So 2 weeks isn't long enough to actually see how the body is going to truly respond to it. You need to give it that 2 months. And within that 2 months, you have to kind of grade the exercise, because, my rule of thumb is I don't want you to have soreness, like true soreness related pain, more than 2 to 3 days. So if I do an exercise that afternoon, maybe a little tired, next day, maybe a little soreness, but going on to that second, third day, I should be active recovery, doing some more, and then it should be transitioning. But the biggest thing is just how much you load your tissue. So if I overdo it from work, from stress, from life, things like that, that's a lot of load on the tissue that we don't account for. So sometimes what I have to do is back that off, because stress is stress. But with that stress, that's the only way the body adapts and gets stronger. So maybe a day that I'm just not feeling it, kind of like you talk about all the time in your classes, I'm not feeling it. Do what you can. Maybe instead of maxing out that day, we do accessory work or whatever. But in nearly every instance, moving and grading it to what your body can do is almost always better than not doing it. It's just a tissue load thing. And 85% of the world at some point in time, based on research, has back pain. Of those 85% of the people that get back pain, 90% of them get better regardless of whether they do anything about it. And I always tell my clients that stat, and I say, hey, my goal is you're going to get better, but I want these occurrences to be less. I want you to be stronger, and I want you to know how to fix it if it starts coming up in the future. I want you to be smarter than any trainer, clinician, anyone in the area. I want you to have all the knowledge to empower you to do it, because life happens. I mean, things pop up. There is no injury prevention program out there that's 100%. I mean, either there's two types of pain. You're going to have chronic pain from not doing anything, and 80% of all diseases are linked to lack of mobility, poor diet, stress, like that. Or you're going to get acute pain. You're outside playing with your kids, you step in a hole, you fall. That kind of pain gets better, but that's also what we train for. We train for falling, abnormal movement. The stronger our tissue is before we go into something, the better it's going to recover. So that's kind of my thought with that.
Boom. That's good. That's exactly. I think that's what people need to hear. Going back just a little bit, would you say that when people do start their routine, so I already know my answer to this, but when people do start the routine, they think they can go a little harder that they actually can? They try to dive in a little bit more than they should be?
Yeah. Less is definitely more. Um, Being in the medical field for a long time, I've kind of decided that I try to give people 2 to 3 big exercises for a couple weeks, let them get that down. And kind of like you talk about, it's all movement based. Once you can master the proper hip hinging, squatting, lifting, all that kind of stuff, that's where you want to go. And then progress to like compound movements and stuff like that. But if I can get a lot more out of a sit to stand exercise or a squat than I can having somebody sit down and just do knee extensions, like that kind of thing. But people do a lot more than they realize, and then 2 weeks later, all that stress has accumulated, and they're like, "Oh wow," because they get these hit workouts to where they feel like, "Oh, I've got to go in and I've got to really, make myself feel the pain or make myself, exercise 8 out of 10." And if you look at endurance research, if you look at Olympians and things like that, 60 to 80% of their training is zone 2. I mean, their heart rate is barely up to zone 2, and they're doing that 6 days a week.
What would that mean
So
to a regular person?
for the average person, say your resting heart rate is 70, 80, zone 1 would be just barely above that, like 10, 20% above that. Zone 2 would be just a little bit above that. You would be able to go for a walk with your family, talk the entire time. It would be like a 6 out of 10 on the effort scale. You're a little breathless, but not bad. But you could do it for a really, really long time. That's zone 2. That's the training that people need to maximize, because that gets your base level up. If I go hard all the time, I'm going hard at work, going hard with my family, not sleeping, and then I go and I train, I never get my base is all actually down because I'm going hard, 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 hard. I never get to recover. But if I build that base up, then when I do need to go a little bit harder, I've got a much bigger ceiling to go for. So, it's amazing when you look at Olympians, they go on these 4 or 5 hour bike rides and they're talking, they're riding slow, but they ride for 4 or 5 hours. And then one day a week, they go hard. Whereas everybody else thinks, oh, no, I need to go hard 6 days a week. It's the same thing with training. And that's why your program is really effective. It's all right, let me get in, big movements, 30 minutes. It's variety, it's movement based, it's technique. And so, yeah, less is definitely more. And then that way, the more variables that you have, the harder it is to figure out what's causing the problem. Because if I come in and you do an hour's worth of exercise and I give you 30 different exercises, which one caused the problem? It's the same thing if I give people 8 exercises to go home. That's why I tend to tailor it back. This is all I want you doing. Coming in next week, and then we'll see how you feel.
Sure. No, that's exactly it. And I have the hardest part in here is telling people to dial back, especially in the beginning. Dial back. In this first few weeks, I don't want to see them going super duper hard even. I just want them to nail down their patterns, get the movements in. Could you go hard and get really quick results? Sure. But your body's not ready. Your body's not prepared. You're most likely going to end up in some kind of pain, with some kind of injury. It's not going to you're not going to feel good. You're going to be sore all the time, and you're going to want to stop. And the key is you've got to start out and allow yourself to continue long term. No, that's great. That's awesome. That's awesome. So now let me go to the next one. I got another one now. All right. So let's say you talked a little bit about it, acute pain, acute injury. One day I pick up a box at home, twist to grab it, and I tweak my back. All right. I tweak my back. It hurts a lot. I ice it, the everyday stuff, take some ibuprofen or whatever. Couple weeks later, it still hurts. And should I stop exercising? Should I stop doing things? Because a lot of times what I hear, I need to stop. I need to rest. I'm going to stop doing stuff. What do you think? What should they be doing at that point for that?
It's a little individual and different for the person, but many times it's like you'll hear people all the time. Well, I dropped my ink pen in the floor, and I've been over and I picked it up, and my back went
Right.
out.
Yes.
Your back didn't go out. It didn't go anywhere. It didn't go on a date or anything. It's still in it's still there.
Yeah.
But it's not the simple fact that you've been over and you picked up a pen or you picked up a box, like you said. It's the 20 or 30 years above that, before that. So it's sitting at a desk. It's not doing the stuff that we want to. That has a cumulative effect for that amount of years. And then that was the one little thing. You could have done anything. You could have been down tying your shoes or something. It was that one little time that it did it. Vast majority of the time, it doesn't mean that anything is really, really wrong. It's just something is, abnormal at that point. Again, more times than not, you're going to get much better benefit is if you kind of maybe tailor it down a little bit, but you keep moving. You walk. You, instead of maybe coming in that day, and if they're going to do an online training session with you or see you in person once all this is done, it's like, hey, back feels a little funny. Let me stay within my pain ranges. And the PT that I work with, Alyssa, who's one of your clients, that's what we talk a lot about to our clients. It's like, okay, I want you to go, and if you base it on pain research, we're going to keep working, but I want you to stay within that 2 to 3 out of 10 pain range, because the tissue responds pretty well. I go to where I feel a little bit, but I don't want it to get into that 4 or 5 out of 10, that kind of thing.
Right.
And you keep moving. And then after a week or so, it's like, hey, I'm doing a little bit better. The tissue's starting to respond. I'm feeling better. And then you can start adding from there. Of course, there's detrimental effects. If I do something and then I immediately go try to do a HIIT workout or run a half marathon afterwards or stuff like that, the tissue may not be ready. And then that sets you back a little bit. But on the other end of it, shutting it down for 2, 3, 4 days and then stuff, then a lot of times that gets in a negative cascade. So now you're losing some of your gains. You're not moving, because the more movement we have, the more blood flow we have going to the area that's the problem, whatever's causing the problem. The more I can get some blood flow, that's how the body gets that healing property to it. So moving is almost always better, because even after major back surgery, the one thing that the spine surgeons are going to tell you, hey, go home. I want you to start walking. You need to be walking up 30 minutes a day. And that's like day one. You're walking, as soon as you get up on the floor, we're going to come see you. And you've just had a major spinal surgery, much less being at home and I just been over to pick up a box. So, the body is so resilient and the spine is so strong. I mean, I've seen people with, you would look at their x-rays and you would look at their MRI and they've got 30 different things wrong with them. They've got spondylolisthesis, they've got stenosis, they've got the degenerative disc, they've got everything in it, and they have zero pain, none. And then you get in your 20-year-old person who their test results come back perfect and they have 10 out of 10 pain. And so you're not your test. That's always what I tell people. If you go get a test, just because the test says, hey, I've got XYZ, that does not correlate to pain. There's so much research that shows that. The test is one piece of the process. It's kind of like anything. It's one data point. But also when you get a test like that, when you get an MRI and you get an x-ray, that's not how human biology works. You're laying in a tube or you're getting a picture taken while you're not moving. You don't have much blood flow. Your muscles aren't moving. You're just laying there. You're static. So when you get up and you move and blood starts flowing and muscles start doing what they're doing and things like that, the anatomy is different. It's much, much different than what that picture shows you. The body is very, very adaptable. Tissue is very, very adaptable. And one thing that I always tell my patients, one of my favorite research studies out there, is at the last Summer Olympics, they scanned every Olympian's spine, and it had like 40 to 50% of people who would have, quote unquote, a disc issue. These are Olympians, best in the world, the true elite out elite. They came back with nearly half of them having some kind of spinal problem. A year later, they rescanned them, and 80% of those scans came back clean. So the body can reabsorb a small bulging disc. It can reabsorb a lot of stuff, but it also shows that you've got the world's elite that are training pain-free. They just did a scan to do the research. And it shows that what their scan showed does not correlate to their performance or their pain or anything like that. And then later, the body actually took care of itself when they weren't training like crazy Olympians, that kind of thing. Now, there are cases to where absolutely medical intervention is. I mean, we live in a day and age that's amazing that, if you do have a ruptured disc and it's causing numbness and tingling and, a lot of other issues, you can go and get it fixed. There's absolutely a case for going to the doctor and things like that. But the biggest case is keep moving and doing that because, I've got, like me, myself, I have a torn shoulder labrum. Actually, I've got two. I've been trying to stay away from surgery for as long as possible because I know the outcomes are about 50-50, whether I have surgery or not. Now I've been doing a lot of stabilization, a lot of stuff that you've been giving me. I am pain free. Now it took me 6 months of doing what I'm supposed to because I had gotten tight, I had gotten weak, a lot of cycling, things like that. And now I'm pain free, but it took 6 months worth of work. And as long as I do that the way I'm supposed to, I have no pain. If I don't, then I end up getting pain. And that's where some of the surgeries come into play. It's you always weigh it because what I tell a patient is, hey, you've tried this, you've tried all this kind of stuff, and then if surgery is an option, no matter what you end up deciding and your doctor ends up deciding, the stronger you are going into it, the better you are moving in, the better your outcome is going to be. So even if you do have an issue, training before that is what dictates your outcome.
Yes.
So that is the number one thing that people need to hear. It's like, hey, I'm going to have back surgery. I'm going to have shoulder surgery. Keep training as much as you can leading up to that because people will take 2-3 months off and then they think the surgery is going to fix it. And now you're debilitated going into it. And now you've got a major surgery to recover from. So,
well, yeah. Even if you have an injury, if you do nothing, you're going to get weak. Everything that supports that joint is just going to get weaker. Like there's no way around it, and before I forget, this other one I wanted to hit on. So would you say that for most people, if you just have again, you tweak your back, you don't feel that good, is getting an MRI and an X-ray, is that a good thing to do to show you why your back hurts?
Well, nowadays, insurance is going a lot more conservative measures, which I like. The patients a lot of times will get frustrated. They come to see us in therapy and they're like, hey, insurance wants us to see you guys for 2 months and kind of see. And the vast majority of people get better without ever knowing what the X-ray or the MRI shows. And a lot of really good skilled therapy, they can tell you based on, like when the PT does your evaluation or when a doctor looks at you, just based on your symptoms and stuff, you can pretty much kind of tell you what many times the scan is going to show you anyway. I mean, we've been in society for a long, long time. X-rays and MRIs are still a relatively new thing. They've been around for a while, but all this modern medicine is still relatively new. We've got many, many centuries of a lot of clinical management and things like that to go by and base it on, which is pretty remarkable, going all the way back to Da Vinci. But X-rays and MRIs, again, they're one piece of the puzzle. It can be something that helps because if you have a chronic issue and you've done everything that you're supposed to, you're doing your strengthening, you're doing your cardio, you're doing range of motion, you're eating well, you're doing everything that you can take care of, and then you still have some issues, it may not be a bad idea to touch base with your doctor. But sometimes the bad idea is immediately to run to that and say, hey, can I go ahead and get an X-ray or MRI and see? Because it may not show anything, and then you're even more frustrated, or it may show some sign or test that has nothing to do with where you're having your pain. You've got a little bit of degenerative disc or a little bit of arthritis, and that is a normal finding. It's really not that abnormal. Right. When I've had my scans, it already shows me, in my 40s, I've already got it. I actually have zero pain with that. But with arthritis, like Andy says all the time, the best thing we can do with arthritis is strengthen, because if you strengthen the muscles that support the joint has less force on it, which protects the arthritic surfaces. Because if somebody's going to have a total knee replacement or a total hip, and when you get to that point to where you absolutely have zero cartilage, then sometimes that becomes the option. But if I can get the muscles and everything around it really, really strong, and then they go in and they fix it, afterwards you're going to do so much better. That's the one thing I see. The people who are super active before, keep up with their stuff, then afterwards their rehab is so quick, and then they get back to what they're doing. So it's always a double-edged sword, but it's one, those diagnostic tests are one piece of the puzzle. And then talking about arthritis, the really, really cool thing that we're starting to see in science and research is many years ago, and even not that many years ago, less than a decade, you would see people that would link arthritis to, I ran too much as a kid, I played sports too much, or my job, I was standing all the time, and things like that. And almost all the new research in the last 5 years is showing that if you look at their their peers who are office workers who do not move as much, they have much more evidence and prevalence of arthritis than people who are more manual laborers or people runners. And a really big research study out there they followed 20,000 runners, and these were runners who were putting in more than 10, 20 miles a week. And then they compared that to 20,000 of their peers who did not run. And after 10, 15 years, the runners had much, much less arthritis. I mean, it was a tremendous amount less arthritis that the runners had. So the runners' joints were healthier, their cartilage was stronger, their muscles were stronger, their body weight was lower because they ran. The people who did not run, office workers, things like that, they had much more arthritis because they had more medical comorbidities, they weighed more, things like that. But I heard a doctor say this, and I've stole his line the whole time. If you think of your cartilage and your joints like a sponge, so like a sponge that you're going to wash your dishes with.
Mhm.
If I wash the dishes and the sponge is nice and moist and I can do what I want to do with it, then it functions the way I want. So think of that as your joints moving. Now, if you leave that sponge there and it dries out because it hasn't moved, it's not hydrated, it gets really, really brittle and it'll break. That's the same thing kind of if you think about it with your joints. If I'm sitting around all the day, if I'm not doing what I want to do, I'm not getting great blood flow because joints don't have great blood flow to them. You have to move to get blood flow to them to get the synovial joint in the joint to move. If I'm not moving, those tissues get really, really brittle. And you do that day after day after day. You don't hydrate yourself well. You don't have strong bones, muscles, things like that. Your arthritic risk is going to go higher. Osteoporosis is going to go higher, things like that. So movement, it really is life. It really is key. And it's just frequently moving. And sometimes if we have pain, we have to tailor it. If we have injuries, we have to tailor it. I always tell my patients, graded exercises. I mean, some days you can go really hard. Other days you back it off week by week. It's kind of the state of the world we live in right now. I mean, we can't plan for anything. It's day by day. You just have to listen to your body, but you just have to keep going and moving. And that's the best thing I can say.
Yes. And learning and starting to learn about your body, what it can, what it can't do. But there's never anything that's really off limits. You just have to work into it. If doctors might say, you may hear a doctor say, well, you shouldn't be squatting anymore because you have bad knees. And it's just getting down. I say all the time, you're going to sit on the toilet the rest of your life. You're going to get down to go to the bathroom for the rest of your life. So you're squatting. It's a squat. But you might have to work into that to strengthen at a higher range of motion before you're able to squat deeper. You just have to. You work into it.
Right.
So, that's part of what it is. And also with, what was I talking about before that part there? Where was it? If you're getting injured. So another one, and I should have said this too, it also, your recovery is also going to be varied based on how in shape, how fit, how healthy, how strong you were before all these things happened. And your age is also going to play a role in it. There's a lot of variables. But if you've been sedentary for 20 years and you twist and you hurt yourself, it could take a long time for you to get back. It could take many years for you to get back to feeling better. But if you've been taking care of yourself for the last 20 years and you twist and you hurt yourself, which you could pop back relatively quickly. So there's a lot of variables, but you just said it. The key is keep moving, stay strong, and drink your damn water, wash your hands, all that shit. Do that stuff. I think for today, I'm going to cut it there because there's a whole lot of stuff to talk about. We'll do another one of these because that was fun. I learned a whole lot of stuff, learned a lot. And Chancey, appreciate it. I appreciate your time, man. And guys, pay attention. There's nothing wrong. Your back's not broken. Your knees aren't broken. Keep moving. Stay strong. Work within the things you can do. Okay? And if you need any help from us, Tri-Pillar Fitness, reach out. Chancey trains there. We can help you out. All right. Take care, guys. Thank you.
Thanks.